Every year, millions of families around the world hear three words that change everything. You have breast cancer. But what if awareness could save lives? Today, we will talk about breast cancer, what it is, how to detect it early, how to reduce your risk, and why hope is stronger than fear.
What is breast cancer? Breast cancer occurs when healthy breast cells become abnormal, grow out of control, and form tumors. It can affect both women and men, although it is far more in women. 1 in 8 women will be diagnosed with breast cancer in their lifetime, while 1 in 1,000 men will be diagnosed with breast cancer in their lifetime. These abnormal cells can stay in the breast or spread to other parts of the body.
Cancer in milk ducts. Breast cancer that develops inside the milk duct is called ductal carcinoma in situ, or DCIS. When DCIS spread into surrounding tissue, it is called invasive ductal carcinoma, or IDC. Cancer in lobes. Abnormal cells can develop in the lobes of breast, called lobular carcinoma in situ, or called LCIS. When these cells spread in the surrounding tissue, they become cancer, called invasive lobular carcinoma. Common signs and symptoms. Always pay attention to change in your body. Warning signs may include a lump in the breast or underarm, change in breast size or shape, dimpling or puckering of the skin, nipple discharge, redness, pain, or swelling. Not every lump is cancer, but every change should be checked. Some factors increase the risk of breast cancer, like family history of breast cancer, increasing age, hormonal factor, early period, late menopause, obesity and physical inactivity, smoking and alcohol. Screening for breast cancer can help find cancer early and save lives. Screening includes examining your own breast, clinical breast exam by your healthcare provider, having the X-ray of your breast called a screening mammogram. You can check your own breasts about the same time each month. Feel each breast and armpit and look at any of the signs of breast cancer previously discussed. A diagnostic mammogram, used when changes seen on the screening mammogram, even seen extra detailed images of breasts. A breast ultrasound is often used to determine if a suspicious lump is solid or fluid-full. A fluid-full lump is often benign or cis, while a solid lump can be cancerous or benign fibrosis. Breast MRI shows more details than a mammogram and is often used for many small masses or changes in the breast that cannot be seen by a mammogram. A breast biopsy is a test that removes few cells or small amounts of tissue from the suspicious areas in the breast. There are various types of biopsies. A doctor, called a pathologist, will analyze breast biopsy tissue by looking at the cells under the microscope and doing specific tests. The report will let you know if you have cancerous cells or if they grew because of estrogen receptors, progesterone receptor, or human epidermal growth factor receptor 2, HER2, protein on the cancer cell. The results of these tests help your doctor to choose Doctors classify breast cancers based on how they behave. This includes non-invasive, cancer that is not spread outside the tissue or begins, invasive cancer that has spread and invaded healthy tissue, recurrent, cancer that returned after it's treated, metastatic, cancer that is spread where the areas it is started to other areas of the body. Common types of breast cancer: invasive ductal carcinoma and invasive lobular carcinoma. Less common types of breast cancer include inflammatory breast cancer, tubular breast cancer, colloid breast cancer, and metaplastic breast cancer. What is triple-negative breast cancer? Triple-negative breast cancer means tumor has no estrogen receptors, progesterone receptors, or human epidermal growth factor receptor, HER2 protein receptors on its surface. Triple-negative disease may have worse outcomes and often require more intense treatment. Breast cancer staging is determined by the size and location of the cancer or whether it's spread to other parts of the body. Breast cancer are graded as 1, 2, 3, with 1 being the more similar to normal healthy cells and 3 being the most different from normal cells and the most aggressive.
Treatment depends on the stage and type of cancer. It may include surgery to remove the tumor, chemotherapy to destroy cancer cells, radiation therapy, hormone or targeted therapy. Modern medicine has made breast cancer more treatable than ever before. Common type of surgery for breast cancer are lumpectomy, removing the tumor and a part of healthy normal tissue around it, simple mastectomy, removing the entire breast, modified radical mastectomy, removing the entire breast and lymph nodes under the arms, prophylactic mastectomy, removing one or both breasts to reduce the risk of developing breast cancer, mastectomy with reconstruction at the same time as the removal of breast, sentinel lymph node biopsy, the procedure to determine if one or more lymph nodes contain cancerous cells, and axillary node dissection, surgery to remove lymph nodes in the armpit region. Reconstructive surgery is the procedure done to restore the appearance of the breast after a mastectomy or large tumor removal. Radiation therapy uses radiation energy to kill cancer cells. It is mostly recommended after surgery or chemotherapy. Chemotherapy is the use of drugs to destroy cancer cells. It is given as IV or a pill. Chemotherapy is used to shrink the tumor before surgery, called neoadjuvant therapy, kill cancer cells after surgery, called adjuvant therapy, and control metastatic breast cancer, called palliative chemotherapy. Hormone therapy is given if your tumor is positive for the hormone estrogen or progesterone. Hormone therapy is used to lower the risk of breast cancer coming back and help shrink or slow the growth of metastatic, estrogen-positive receptors, breast cancer. Tamoxifen and aromatase inhibitors are common hormone therapy for breast cancer. Target therapy uses drugs or other substances to identify and fight specific types of cancer cells with less harm to normal cells. Target therapy stops cancer cells from growing, identify and kill cancer cells, and increase immune system attack on cancer cells. HER2 is the common protein that is blocked with targeted therapy. For example, trastuzumab is often given a long way to chemotherapy. Metastatic breast cancer is the cancer that is spread from breast to other parts of the body. The most common places are liver, bone, lungs, and the brain. There is no cure for metastatic breast cancer, and treatment is prolonged survival. How to reduce your risk. While not all cases can be prevented, you can lower your risk by maintaining a healthy weight, exercising regularly, eating a balanced diet rich in fruit and vegetables, limiting alcohol and avoiding smoking, managing stress and getting enough sleep, going to regular screening. Healthy habits protect more than just your breast. They protect your life. Breast cancer is not just a physical battle. It is emotional. Support your family, friends, doctors, and survivors' communities give strength. Millions of women and men have survived breast cancer, and their stories prove one thing: cancer is not the end of hope. Breast cancer awareness saves lives. Talk about it. Share this video. Your awareness today could protect someone tomorrow. Please like, comment, and subscribe my YouTube channel.